vaccine.
Yeah, absolutely. Joining us live now is Dr. Peter Johnson from BayCare Clinic. Doctor, we're talking about a new study out. Most people think for cervical cancer screenings, you think of a certain test, but now we're thinking HPV testing instead, right?
Yes, this study was on over 40,000 women across the country, and it showed that there may be benefit of HPV testing over the traditional Pap testing. You always think Pap test every year.
Yes.
That's changing. The guidelines have been for some time that we can stretch out those intervals. Now an option, not necessarily what absolutely has to be done, but an option is HPV testing instead of the Pap or in addition to the Pap.
Now that's what we were saying before. It's important to talk to your doctor, get maybe both tests, not just one or the other, right?
Yes, I think what's called co-test, doing HPV plus the Pap, is the ideal at this point till we get more information.
If I could just interject, I'm going to allow her to ask every question on this topic, but go ahead.
I think I'm the expert on this one, probably.
I'm
I would
lost.
say so. So most women may not even know that an HPV test is out there or even what it is. I mean, it's fairly new, right?
It's the virus that's thought to cause most cervical cancer and the precancer. That's the beauty of Pap testing. Find it before it turns into a cancer, treat it, prevent cancer from developing.
How treatable is cervical cancer if it is detected early?
If it's detected early, highly curable.
Okay, so I mean, it's important to be getting these tests done, right?
Yes.
Asking your doctor, making sure that you are on the right, level of confidence in getting these things done.
And also to consider the vaccination. There's a new vaccine out that may well prevent 95+% of all cervical cancer.
Now that is, again, that's newer as well, right?
Yes. The one that was out there before was 70%. Now we've got it well up above 95%.
So what ages, do usually girls get those kind of vaccinations?
Ideally, age 10 to 14, young, before they ever begin sexual intercourse.
Oh, so we got to ask about HPV and men as well, because there are men that are watching this. I mean, is this helping them as well, getting these kind of testing?
The testing isn't as well developed or as well tested in men.
Okay, gotcha.
Can a guy get that?
Guy can get HPV, that's how it's transmitted.
Wow.
Yes,
Yeah.
so the
Okay.
vaccinations are important for that. All right, good information, Doctor. We appreciate it.
Thank
And for
you.
more information about this study and about Dr. Johnson, just visit our website, NBC26.com, and click on this story. Thanks for being with us.
Thank
We
you,
appreciate
Doctor.
it.